Later this morning, the White House will announce that hospitals have agreed to cut $155 billion from healthcare costs over 10 years. Bloomberg's Lizzie O'Leary joins us now from one hospital the administration is touting as a cost-cutting model. Lizzie.
Well, Chris, I'm at the Mayo Clinic, and this is a place that the White House thinks really tackles the magic bullet in healthcare reform, which is cost control. This is a place they say does cost control right.
Listen to the president talk about health care, and one place keeps coming up.
The best in the world. People fly in from everywhere to go to Mayo Clinic to get treated. Turns out Mayo provides care much more cheaply than a lot of other health systems.
Mayo does that in part because it pays for care differently. Doctors here, like heart surgeon Toraf Sant, are on salary, so they don't get paid for ordering another test or scan. That's known as fee-for-service, a model Sant left behind when he left a job in St. Louis to return to the place his father was a surgeon, Mayo.
Here, I feel very free to be able to say to someone, you know, I think we just watch this a little bit more. Let's just see you again in the office in 6 months.
Those kind of tests cost money. Dartmouth College has been tracking healthcare spending for 20 years, and here's what they found. More spending doesn't result in better care, and spending was driven by a flawed payment system. The system Mayo's salary plan is designed to avoid. Mayo isn't alone. Kaiser Permanente, the Cleveland Clinic, and many smaller providers pay doctors a fixed salary. By some estimates, as many as 30% of doctors operate this way. But replicating that nationwide is a challenge.
We have a culture in medicine which is fairly autonomous and in some cases kind of resistant to this.
It's also a lobbying battle, shifting the way hospitals, insurance companies, and doctors do business. Mayo's CEO says his model is the best one, but the political will is an open question.
I see people in Washington who understand what I'm saying. I see them having trouble being able to make it work, because politics is about the art of what's possible. This is not a political issue. This is a leadership issue.
Dr. Cortese says he talks to folks in the White House, in the administration, but actually he hasn't actually spoken to the president, and the president has never been here to Mayo to see how they make this model work. And for all this talk about a public option and expanding coverage, Chris, it does to some degree become a moot point, because even if you have that $1 trillion price tag for an overhaul plan that you were talking about earlier, it doesn't really matter unless those costs can be winnowed down and gotten under control, Chris.
Lizzie O'Leary, thank you so much, Lizzie. We'll be expecting that announcement from Vice President later today.